Good morning, good afternoon, good evening, everyone. I am Dr. Richard Gregory Johnson III, Professor of Public Administration and Policy in the College of Arts and Sciences at the University of San Francisco. It is my great pleasure to welcome you in my role as Global President of the Pi Alpha Alpha Society. Pi Alpha Alpha has been around for decades, and we have inducted so many great members, and we've done so many great webinars and workshops and so forth. And today we will have one of those great webinars, and we're so excited to welcome each of you here. A special shout out to my students at the University of San Francisco, my MPA students and UPA students, and to all of the MPA and doctoral students in public administration. And so, with that in mind, before we begin the panel, I just want to do some quick introductions. Again, I have the distinct honor and pleasure of serving as the global president of Pi Alpha Alpha, but of course, I can't do it alone. I work with some outstanding individuals and who are committed to upholding the academic rigors of our field. And so if when I call the steering committee, if you guys can just raise your hand or quickly just say hi, that would be great. So what I'm going to start with Alex. He works at NASPA and has been doing behind the work scene and in front of the work. He's just great. So Alex, thank you so much. Appreciate your hard work. Uh, Dr. Sophie Lee.
Hi, Sophie
Doc,
Lee from Metropolitan College of New York.
thank you. Dr. And I always mispronounce his name. I apologize for that. Shahani from
Shahjahan.
yes, is he here?
Shahjahan
Okay.
is not
Uh,
here.
He's not here. Okay, that's fine. I know that Dr. Caper said that she had a commitment, but she will try to be here. She's from Georgia State. Um, Dr. Uh, Soon to be Dr. Karen Mayo from University of Alabama, Birmingham. So, and she's on the panel. We'll hear more from her. Thank you. And then Dr. Adesisi, is she on? From SUNY Buffalo. Dr. Elizabeth Overman, we just heard from. She's our discussant for today's panel. Dr. Phil Nufio, is he on?
He's on.
Okay, Dr. Nufio?
He's on, but he's
Okay.
in the attentive room.
Uh,
Mm.
Bill, I've sent you an invite to join as a panelist, and you
okay.
go ahead and accept.
Okay. And then we
Okay.
have, thank you, Alex. And then we have, of course, Dr. Bach, John from King State University or King University, who's on the panel as well. So thank you, Dr. Bach. Am I missing anyone
I'm
from the
here
steering
now,
committee?
Richard. I joined as a panelist.
Thank you, Dr. Nufio. And where are you coming from? Which university?
Metropolitan College of New York.
Thank you so much. Appreciate it. And that's also where Dr. Sophie Lee is, who was just appointed to the rank of Associate Dean. So we're very, very excited for her in the work that she's going to be doing. Have
Thank
I
you.
missed? Yes. Have I missed anyone from the steering committee?
Yeah.
Yes? No?
Akim
What's up,
Sadiq
Abdul?
Uh,
from it's all right. From the University
How
of
can you
Central Florida.
forget?
Oh
It's
my
okay.
goodness.
No,
And
no worries.
Akeem is like right in front of me. Like, oh my goodness gracious.
That's a problem.
Akeem, Dr. Akeem, I'm so sorry. Oh my goodness gracious. How well, you know what it is. Of course, I'm reading down a list. I didn't see your name right away. So, but definitely Dr. Akeem is one of our longstanding committee members. And is just doing some great work, not only with the committee, Pi Alpha Alpha committee, but also down at his university, University of Central Florida, where he's making a huge difference to that community. So, Dr. Akeem, thank you for all that you do. Appreciate that, brother. Okay. Am I missing anyone now? And Dr.
Yeah.
Funderburg from Illinois State University. I'm sorry, University of Illinois Springfield couldn't be with us today. So, but he sends his regards. Anyone else?
Yeah, I'm here as well. Hamad Al-Karamani from the American University in Cairo.
Yes. Well, you're on the panel, so I'm going to introduce
Yeah,
you. So, yeah, so thank you.
thank you.
And I appreciate that, especially help with your name. So, so thank you, folks. So, again, let's give it up for the steering committee, the global steering committee, because they are the ones who really carry on the work of Pi Alpha Alpha, and I could not be more thrilled to work with each of them. At this point, I would like to again welcome everyone to the Pi Alpha Alpha Spring webinar. Today's webinar is entitled The Role of Public Sector Collaborative Governance and Addressing Global Food Insecurity. This is also the theme of Pi Alpha Alpha for this year, and we believe that is a very timely topic, and we're thrilled to bring this webinar with such esteemed colleagues who are doing the heavy lifting. And so, with that in mind, I will just very briefly introduce the speakers, but then also I will put their bios in the chat for everyone. So, without further ado, Dr. Bach from King University, Associate Professor, I believe Dr. Bach uh, just went to put on his Pi Alpha Alpha shirt. And in case you all haven't noticed, the steering committees, most of the steering committee members are wearing our Pi Alpha Alpha sweatshirts. We got these sweatshirts about 2 years ago, I think, and they were such a huge hit that we always wear them anytime we have a public facing event. So um, and it's just it's kind of like our hallmark now. So people expect us to wear it, and they're such great sweatshirts. Compliments of the NASPA organization, which we're a part of. And next we have Miss Karen Mayo, soon to be Dr. Karen Mayo from the University of Alabama at Birmingham. Miss Mayo, thank you so much for joining us. We look forward to your comments. And then we have Dr. Kavis Durr. Is Dr. Durr on, please? Okay. Dr. Kim, I know this was one of your former PhD students, and we're thrilled to have him. So if you could ping him, please. Something might have happened with the Zoom link.
I
And
will.
next, thank you. And next we have Dr. Mohammed L. Dr. Mohammed, how do you pronounce your last name, please?
El-Karamani.
Awesome. That's a great last name. And
Yeah.
I promise I will learn how to pronounce it. He's Dr. Muhammad is coming from the American University in Cairo, where it is now a little bit after 8 p.m. So we are thrilled that he stayed up to do this panel with us. So thank you so much. And then finally, we have Dr. Overman, who's going to serve as our panel discussant. So and Dr. Overman is coming from the University of Central Oklahoma, where she's down there doing some tremendous work, and particularly around social equity issues and just policy issues. And like she's been down there for years, and I'm sure the University of Central Oklahoma more than values her contributions to the community. So, Dr. Overman, thank you so much for joining us.
Thank you.
And so, in terms of procedure, each of the panelists will have roughly 6 to 7 minutes to do their opening statement, PowerPoint, if they like. And then after that, Dr. Overman will take over with a series of questions. And Dr. Overman, I would like to reserve as much time as possible for audience comments and questions, please.
Sure.
Thank you. And so with that, I will now turn it over to Dr. Bach. He's the first to give his presentation, followed by Ms. Mayo. If Dr. Cavister is here, then he will follow, uh, bringing up the rear, Dr. Muhammad, and then Dr. Overman will take over. So you will only hear from me you will only hear from me again if the panelists have run over. then I will jump in with a cane and pull them off the proverbial Zoom stage. So, though that is not my intention, so uh, please watch out for the time. Dr. Bach, you're on.
Yes, thank you, Dr. Gregory, Richard Gregory George Johnson III, and also thank you everyone and all the committee members, also panelists. And I'm glad to have our Pi Alpha members to discuss today's topic, which is very timely and very important: food security and malnutrition, hunger, and we are living in a time of very abundance. We think that we well off in many sense, but in globally, there's and also locally in community at the same time, the poverty and food security is a significant issue. Especially a lot of issues are really combined. The pandemic really heavily affected all those food security and also recent food prices increase after wars and globally. So it's not only local issues, more global now. So for me, what I want to discuss today is more Asian part because from my originally, I'm from Asian part, but at the same time, I traveled for my research here in South Asian countries to do data collection, also meet those local partners in a couple of South East Asian countries, including Philippines, Nepal, and also Indonesia and Thailand and a couple of other countries where I visited and looked at a lot. It's happening not just only by government, it's also at the same time, and then look through the local and partnership. So today I want to just share how severe that issue is in Asia, in those countries I traveled for my data collection for interviews, but at the same time, how this solution works in not just the government itself and through collaboration and partnership. So in terms of how serious that significant this issues in Asia, and you see Asia has a huge population, of course, but also that's reflected on how much his people suffer with this hunger. And around half of the world's hungry population is actually from accounted by the Asian people. So you see how significant it is. Although you see a lot of growing economies located in Asia, but there's a lot, half of populations of those hunger in the world is from Asia as well. And for example, in approximately 323 million people in Asia experienced undernourishment in 2024, reported by FAO, Food and Agriculture Organization. This is official statistics, which huge number you see. And also, although that number a little bit about malnutrition itself slightly decreased from 8% to 7% in 2024, but still that number is still very high. And also if you see children under 5 years old, actually
Mm.
one out of three and in South Asia experience a long term malnutrition. So that's huge number in terms of how many kids in Asia and those at South Asia and actually experiencing those malnutrition among children. So, and if you see also, you see how each country is struggling with that. So at least, for example, countries in India and Nepal, there are a lot, close to 20% is under poverty line. So that's a lot. You see that one out of five people live under poverty in those countries. Although those countries who live relatively well off than countries Nepal and India, which is Thailand and also maybe Indonesia, in those countries still 10% live under poverty. So in the Philippines, the around 50%, the exact number is 44.7%, and households experience those food insecurity in the recent surveys. So these issues are so big and so significant. So what's happening? What governments do now to take care of this issue, and also who is involved in this process? That's actually we want to focusing on today's this webinar. So having said that, a lot of government in these South Asian countries do their basic roles through government agencies and acts. So they do spend some money in those countries, and of course, Bangladesh and Nepal, in and also India, they have those government agencies. And but at the same time, their outreach to those vulnerable population communities are very limited. So that's what I want to say today. it's not because the government doesn't do its role, but it's really lack of capacity when these numbers are so high and when the outreach is limited to reach out all its suburban and rural areas specifically, and they work collaboratively with other sector agencies. So today's my highlight is more about the collaborative governance, which is actually my research area in general. And I traveled a lot in Africa and Asia, but recent my research is more focusing on Asian components from my recent research data collection fieldwork. So what I would like to suggest some of the examples of how those government and social enterprise and nonprofit collaborative partnership works is there are multiple ways. The first is that as a major role in collaboration, it comes from emergency food relief, humanitarian assistance. So if those emergency hits, for example, in Nepal and those earthquake will hit, and also other countries in recent, and those nonprofits and government work together, especially those immediate relief agencies actually done by these nonprofit and social enterprises and local community agencies. So those are very significant. Given this the climate change, which hit heavily in across the globe, the role of this those community agencies actually has been increasing. So, and that's what I also highlight that from my observation. For example, in the Philippines, so the church-based organizations do significant role, the faith-based organization. So the Philippines is well known for its Catholic, but at the same time, in the southern part of the Philippines, is a Muslim-based country. So now a lot of foundations which I interviewed, they engage in not just only one their religious community, they work across the religious lines and to reach out those communities. That's actually how to highlight how these NPOs and community organizations and related to these the religious faith-based organizations they support and contribute to this. And also there's another component is the community-based agricultural development. And these countries are not all, but most of them rely on still agriculture industry. So in that case, the climate heat really affect, devastate their own capacity to generate, produce those the crops, and also that affect their own poverty, and in the end, they're struggling with its hunger. So in that case, a lot of NGOs and also government to work together to create agricultural development project. So that really helps in the community level to get away and overcome these issues. The another part is nutrition and public health programs. And this part in a lot work together with international organization and central government, but at the same time, local governments to work together on this issue. And a couple of examples for Indonesia, they implement a large scale the child malnutrition reduction programs, and including local government and NGOs and health workers and international NGOs. So that worked very well in Indonesia and also India as well. The Indian case have their own government agency called the Integrated Child Development Service Programs, and they partner with the local agencies. So that's kind of the example about how this service and especially public health actually help by these partners in community level. And the other part I want to highlight is that in the social enterprise, this is my research main area. When I did my fieldwork in Southeast Asia, and I really focusing on these social economy, social enterprises, which is hybrid organization, not just philanthropic, traditional philanthropic organization, but at the same time, they are called hybrid. So they are a typical community organization, but they are using more innovative approach to produce and to make a more revenue income generation approach, maybe innovative approach. For example, in the cases these countries, they use farmer producer cooperatives. And in that case, they work with international organizations as well, international organizations or bilateral agencies or multilateral agencies like Asian Development Bank. They bring funding to this community, but they partner with bilateral agencies like national development agencies like KOICA and JICA. This is a national the support development agency from Japan, South Korea, or Norway and Sweden. They help these communities. They provide some infrastructure support, but they work with the community partners so that can be sustainable, not just one-time program support. So that's kind of the social enterprise works. Social enterprise is not just philanthropic donation, it's make them those communities survive and sustainable through the support and also capacity building and long-term capacity building. Another thing, I know the time is limited, but finally highlight is that so it's not only those community agencies work limited to the service provision and also local partnership. It's also national level advocacy. So one example I would highlight is that in the Philippines, they have recently passed the bill through this interaction with community-based organization and also social enterprises in the Philippines. They just passed successfully with this community-based grassroots movement to push the government to adapt to this issue is that it's called the Present Bill, which is a poverty reduction through social entrepreneurship bill. It was passed because the grassroots-based social enterprises, NGOs, pushed the government to work together on this poverty eradication and food insecurity. Now it's passed. They're now officially using social enterprise channel to address this poverty and also hunger and also food insecurity issue. So that's all I have for today's presentation. Thank you.
Thank you, Dr. Bog. That was very insightful and very uh, just amazingly well said. You've given us a lot to think about, and I'm sure that Dr. Overman will follow up with you specifically and all of the panelists during her part. At this point, Dr. King, do we have Dr. Durr on? If we don't, that's okay. We'll move on to Miss Mayo. If Miss Mayo, are you ready, please?
Okay, can everyone hear me?
Yes, thank you.
And you can see my screen. Good. I'm sorry, I'm off campus at a sustainability workshop and the internet is spotty here. So I would like to talk about the role of the public sector and collaborative governance to address global food insecurity. Thank you all for being here today. We're here to talk about one of the most urgent and complex challenges of our time, which is global food insecurity. When we look closely at this issue, it becomes clear that hunger is not simply a matter of producing enough food. It is a systemic governance challenge that sits at the intersection of multiple United Nations Sustainable Development Goals, or SDGs. Global food insecurity sits at the intersection of multiple SDGs, not only SDG 2, which is zero hunger, but SDG 1, SDG 12, SDG 13, and SDG 17. This interconnectedness is exactly why traditional siloed policymaking is no longer enough. We need collaborative governance that brings together governments, nonprofits, international institutions, and the private sector to work toward shared solutions. The SDG framework gives us a powerful lens for understanding this. SDG 17 calls for multi-stakeholder partnerships, and that principle is essential because no single institution can address the combined pressures of climate change, conflict, supply chain fragility, and inequality. The document states that clearly no single institution, governmental or otherwise, can address the combined pressures that drive food insecurity. Collaborative governance shifts us away from hierarchical models and toward networked systems where authority, expertise, and resources are distributed across partners. This shared approach allows us to build food systems that are more resilient, more equitable, and more responsive to local needs. But to understand why collaboration matters so deeply, we have to look at SDG 16, peace, justice, and strong institutions. This goal is often overlooked in food security conversations, yet it is absolutely foundational. As the document notes, food insecurity is rarely caused by a lack of food alone. It is often the result of weak governance, conflict, corruption, or institutional fragmentation. Strong institutions create the conditions that allow food systems to function. Peace reduces disruption to farming and markets. Justice protects land rights and prevents exploitation. Effective public administration ensures that policies are coordinated and resources are used efficiently. Without these elements, even the best designed food security programs struggle to take root. This is why SDG 16 is not just another goal, it is the enabling environment for all the others. Collaborative governance depends on institutions that are transparent, accountable, and capable of managing complex partnerships. When institutions are strong, they can convene diverse actors, share authority, and build trust. When they are weak, partnerships break down, resources are mismanaged, and vulnerable communities are left behind. This document emphasizes that institutional capacity is where public administration meets global food security, and that insight should guide how we think about long-term solutions. Here on this slide, we see the foundation that's built from SDG 16. And it shows the interconnectedness between peace, justice, and coordination between institutions. Institutional capacity has several dimensions. First, administrative competence. Governments need skilled personnel, clear procedures, and reliable systems for coordination. Without strong data systems, we cannot track crop yields, monitor supply chain disruptions, or identify vulnerable populations. Second, regulatory and legal frameworks, land tenure protections, fair market regulations, and food safety standards all create predictability and trust. Third, accountability and transparency. The anti-corruption mechanisms, open budgeting, and participatory decision-making ensure that partnerships remain legitimate and inclusive. These elements are not technical details, they are the backbone of resilient food systems. When institutions lack these capacities, food systems become fragile. A climate shock becomes a humanitarian crisis. A supply chain disruption becomes a famine. But when institutions are strong, countries can absorb shocks and recover more quickly. They can coordinate across ministries, partner effectively with NGOs in the private sector, and empower local governments to respond to community-specific needs. This is why SDG 16 is a prerequisite for SDG 2. Peace allows food systems to function. Justice ensures equitable access to land and markets, and strong institutions coordinate the partnerships needed for sustainable food systems. For emerging public service leaders, this has profound implications. The SDGs call for leaders who can work across boundaries, build trust among diverse stakeholders, and design systems that are resilient and equitable. That means investing in administrative systems that support collaboration, strengthening local government capacity, building robust data and monitoring systems, and promoting transparency to maintain public trust. These are not optional skills. They're essential for governing in a world defined by complexity and interdependence. So in closing, global food insecurity is not just a humanitarian issue, it is a governance issue. And the SDGs, especially SDG 16 and 17, give us a roadmap for addressing it. If we strengthen institutions, embrace collaborative governance, and commit to inclusive, evidence-based policymaking, we can build food systems that are not only productive, but resilient, equitable, and sustainable. The challenges are immense, but so is our collective capacity to meet them when we work together. Thank you.
Awesome presentation. Thank you so much, Ms. Mayo. You've definitely given us a great deal to think about in terms of how we get at this issue and the partnerships that can happen. And your presentation very much aligns with Dr. Bach's presentation. It's
Yeah.
almost like you guys wrote together. It was just amazing. Uh, we want to wish you well with finishing your doctoral degree.
Thank
Please
you.
let us know when that happens and we'll celebrate together. And then finally, thank you so much for taking time from your sustainability conference to be with us. We thank you.
My pleasure. My pleasure. Thank you for the opportunity.
Yeah, no, it's awesome. Thank you so much. And now we will have our last panelist, and then we'll have Dr. Overman take over as discussing. So we have Dr. Muhammad joining us all the way from American University at Cairo. Uh, and again, just could not be more excited that he has joined us, given the late hour where he is in Cairo. So, Dr. Muhammad, thank you so much.
Thank you, Dr. Richard, for having me today. And I try to make my talk as much brief as possible, but hopefully reflecting on something a little bit different by focusing on the case and situation in Egypt.
Mm-hmm.
I don't need to mention all the figures and numbers about, the prevalence of food insecurity with its multiple features and dimensions all over the world, the increase in the number of people suffering from food insecurity and hunger, specifically the severe form of food insecurity, the issues of affordability, and the multifaceted nature of food security that does not only mean food production, but rather the other features, including undernourishment, malnutrition, overnutrition, and all the other features and all the other diseases associated with food insecurity. So yes, certainly it's the collaborative governance is very important given the complex nature of food systems. So it's not just food production, but we have several characteristics of the food systems that make it really complex, and really no single actor can be in control of the entire institution of food. The issue is, I guess, that in contexts where you lack the concept of food sovereignty, it becomes more complicated. And this is what we have been seeing in Egypt over the past, I would say, almost 10 years. Several factors contributed to this, including primarily the regional and global geopolitics. So the Russian-Ukrainian war, which is so far away from Egypt, has serious implications of food security in Egypt, because Egypt is structurally dependent on food importation, particularly wheat and oil, and both are coming from Russia and Ukraine. So with the outbreak of the war, we have seen, a very high increase and hike in food prices in Egypt, specifically in bread, which is considered a very strategic food commodity in the Egyptian market. And then came the war in Gaza, which also intensified the pressure on the food system in Egypt, and it's on its public finances, because Egypt has all of a sudden became a major humanitarian hub for all the food aid and assistance that go to Gaza, which also added to the pressure on Egypt. And afterwards, it came the conflict between the United States and Iran, which also caused disruptions in the energy market, leading to higher fuel prices, transportation costs, which all contributed to the increase in food prices in the country. Adding to this is, the forced migration because of regional conflicts, whether in Sudan, in Yemen, in Gaza, in Libya. All of this has also led to an increase in the number of refugees in Egypt. So all of these factors combined, they led to a deterioration in food security indicators in the country, and we have witnessed what is called the triple burden of malnutrition. So having undernutrition, at the same time malnutrition because of the poor or the deficiencies in food consumption. And above that, we have obesity, very high rates of obesity. I think it's sufficient to say that 50% of Egyptian women suffer from anemia. Almost third of Egyptian children, they suffer from anemia as well. Quarter of Egyptian children below the age of 5 are stunted. They suffer from stunting and also a high percentage of obesity and wasting. So all of this require collaborative governance, as we all know. But in a country like Egypt, collaborative governance is not easy. It's also challenging because of several factors. Weak institutions to start with, aid dependence at the side of nonprofit organizations and civil society organizations. They are highly aid dependent, and with aid dependence, it creates power asymmetries between actors. When we have power asymmetries, it doesn't lead to a good form of collaborative governance. The absence of data and the government control on data also, it limits the ability of different actors to plan and to design evidence-based interventions. The government itself also focusing on issues such as control, economic development, and other forms of getting engaged with regional conflicts and so on. It leads to limited attention to issues such as food security. So all of this also contributes to weak systems of collaborative governance, unfortunately leading to the resistance of a problem like food security with its different dimensions. Thank you so much.
Thank you, Dr. Mohammed. That was you've given us yet another perspective, as you indicated, from across the world in Egypt, and it's so important that we think about these systems from a global perspective, and you've centered that for us, and so thank you so much for your just great insight into what's going on with food insecurities in Egypt. It's a lot. It's a lot, and sometimes as people in the United States, we don't think about others, right? I mean, other countries and who are facing some of the same issues as we are. So, again, thank you so much for centering that for us. Dr. Overman, are you ready, please, with your discussion part?
Thank you very much.
Mm.
I want to thank everyone who presented on this panel for these incredible papers and for sharing your wisdom, insights, as well as your research. I'd like to start with Dr. El Khomeni and asking him, uh, because we talk about food insecurity, and Dr. El Khomeni talked about food sovereignty. And I think that food sovereignty is moving it sort of up a level in terms of conceptualization. So, Dr. Okami, is it possible to provide a definition of food sovereignty?
Uh, yeah, I think food sovereignty is all about being able um, to control food, simply to have, so you are able to produce the food that you need. You are able to distribute the food across different regions and different groups in a country, and not to be dependent on other actors that whose positions might change due to political reasons. So yeah, that's reflecting on the case of Egypt, for example. I would say that the Russian-Ukrainian war, once again, we have suffered a lot because of that, because I believe we are not food sovereign in that sense. If you import like 90% of the wheat that you consume locally, you become highly vulnerable to conflicts that are too far away from where you are. Yeah, so I think it's your ability to have this such a control on a very strategic and perhaps the most important commodity, which is food. Not being dependent, not being vulnerable, not being subject to exploitation by different political actors or by different countries.
Well, thank you very much. And certainly, I mean, food is basic to every person. Um, uh, on the planet. And your definition in terms of uh, regions or areas, or in your country, the nation state, not being so dependent on food sources that are subject to disruption because of exogenous events, like the war right now that the United States is
Mhm.
waging against Iran, which has moved us in terms of considering uh, sustainability in a wider way, but also we've got to think about food sovereignty when four of the main materials that well, at least 25% of the world is using are coming out of that region, have been disrupted, and we don't have any control. And certainly in nation states, they don't have any control of this when you have an empire that decides to move against a region. Okay, Miss Mao, thank you so much for bringing up the SDGs and talking about the relationship of one to the other. And you did mention supply side disruption, which is what the world is experiencing now. Um, and it's sort of, you also talked about that what were options are no longer options. They are becoming more and more critical as we're moving along with some disasters deepening and widening. Um, so, do you think that the public sector is actually capable of solving these problems without sort of, I kept thinking, moving into profound political disruption and maybe even violence? I don't know. Did she hear me?
I'm not sure. She was experiencing some,
A
uh,
disruption?
speaking of disruption. Ms.
Right.
Ms. Mayo, are you on?
She's not on.
Okay.
Oh, okay. Well,
Okay.
then, Dr. Bach, uh, thank you for this incredible presentation. And I think that the idea of social enterprise is very interesting. And I'm sort of wondering how that fits in with the idea, perhaps you didn't mention food sovereignty, but it seems like it would nicely sort of, they would work together. And I was just wondering how widespread are these entities that are actually doing this? Or is it a conscious thing and you're looking at what's going on and you're seeing organizations that work are actually instituting these practices?
So thank you, Dr. Elizabeth Overman. Thank you. That's good insights. So, uh, so, so I have a clarifying question. Do you want to focusing on food sovereignty issue or general practices in this social enterprise in their field?
Okay, that brings up another question. Why are they different?
So, the food sovereignty is a part of political international global politics. So, so, so which means how much you can control your community's food versus nationally, right? So, and if you focusing on the poverty as a absolute human right, that could be highlighted in two sense. As a part of conflicts of the global politics, how that affect community. Then the food sovereignty comes in as a main highlight and the main fundamental cause of this issue. For example, the current war in Ukraine and those war between those now is in Iran and the U.S. So then definitely that becomes a food sovereignty issue, right? So it's how you're focusing on the roots of this current issue from where. So then how much these global conflicts affecting the local communities, their survival, but not just local community, but national security level. That's food sovereignty perspective. But if you more focusing on more transnational agenda as food security and hunger, then you will see these organizations across those lines of national boundaries. then it becomes a more transnational agenda beyond the food security issue, more comprehensive. It's not separable, but it's a part of a different aspects. So I want to see, of course, these two insights work in the food security hunger issues because a lot of these food security now issues triggered by this global politics and tension. So in that case, food sovereignty is clearly important aspect you have to be aware how government policy will prevent this coming in and for the long-term perspective, right? So then that becomes a food sovereignty issue, national agenda, and a global and also national political policy issue. But if you're only looking at this poverty itself in the, let's say, global climate change, in national disaster, and earthquake, right? Then it goes beyond this food sovereignty issue in that case. So in that perspective, I would highlight that these local-based nonprofits and social enterprises, their approach is more prevalently important. These cannot really do its own role as a food sovereignty issue because they have limited the control of this national security agenda. But in terms of going into the field and the community level and how you make this community to produce those crops in a more sustainable way with less expense and continuing a community level and regenerate those agricultural production, that's the role of the social enterprises in general. But at the same time, the roles of these social enterprises and also social economy is not separable from the public policy side of national policy or city level and local level government. That's why these social enterprises they worked on changing the role of government, the introducing the law, helping government fund and programs will support these social enterprises to address these food and hunger issues in local level. Hopefully, I answered your question. Thank you very much.
Uh, Thank you for that. And I'm just wondering, I mean, given what's happening now, and some food economists are actually suggesting that because of the disruptions in the Gulf, that we are moving toward, they're talking about world famine in places that are relying on food substances coming in from other parts of the world. That is going to be, it looks like it's going to be compromised. And I'm just wondering if the high levels of existing famine, like in Egypt and the areas you looked at and other places around the world, have actually disguised the fact that we have been moving toward famine in larger numbers than we've actually acknowledged.
Yeah.
And it seems to me that food sovereignty is the solution because, I mean, we eat locally.
Dr.
Uh,
Overman, that is such a profound question, but because we're almost basically at time, what I would like to suggest is that the panelists answer that question in the new discussion board that Alex has set up for Pi Alpha Alpha. I don't know if you all have gotten a chance to look at that, but it's really, I think, a growing resource for anyone, but particularly Pi Alpha Alpha members. So, Dr. Overman, if you could put that in the in that chat, and then if the panelists can respond, that would be great. I apologize, we're running out of time. If it's okay, we have just time for um one or two questions from the audience. And Dr. Overman, if you could um field that, that would be great as well.
uh, I'd like to do that. I don't know how to access the discussion board. We're not talking about the chat, we're talking about something else.
Right.
Hey, Elizabeth. Hey, Richard. It is Alex. Hey, Elizabeth. I'll reach out to you. We can connect about it, and I'll help you get it done.
Okay.
Yeah, because that's not a
That's
question I would want us to rush. That really is a great question.
That's a great question, Dr. Overman. I really appreciate it. Thank you.
Yes, thank you so much. And then again, we only have time. We really are at time, but we'll take one or two questions from the audience. Alex, are we able to do that, please?
Sorry, I'm sorry, Richard. Say that again.
That's okay. Do we have questions from the audience?
Oh no, I've been monitoring. No questions.
Okay. All right. Um, if that is the case, are there any questions from the steering committee? If not, we'll conclude. Any questions from the steering committee? Okay. Uh, Dr. Overman, would you like to just give a closing, please?
I want to thank
Richard, I had a question. Can I ask a question?
Oh
Okay,
yeah, go
sure.
ahead, Phil.
Yeah,
Phil.
in light of the decimation
Mm,
by Elon Musk last year of the Agency for International Development,
Yeah.
did any of you address that in your research and its impact
mm,
on the world?
mhm.
So for me, it's not Elon Musk, but my fieldwork last summer, focusing on the shutdown of USAID, the federal agency, how that affected the field agencies and local government in and also those NGOs and social enterprise in local community, which is all aligned with how those federal government function and institutionalized, right? So as you see, all those U.S. politics is really strongly intertwined with what's happening in Africa and Asia, in Latin America. So what I observed from my fieldwork, I went to Nepal, in Thailand, and Philippines. A lot things happened because it's abrupt, the shutdown of federal agency, and without any the procedure of making this continue. The shutdown itself could happen at some point, but the issue is that how is that happened, and how is that those local knowledges in local based communities in those developing countries, whether those all those institutional knowledge was carried over to the local the entities. That didn't happen. So there's the completely insulation from the prior work that has been significant contribution by the U.S. based supported fund, and completely cut, and also just the fade away without any the lasting continuing impact. So that affected, of course, those agencies working on food insecurity, and also issues about and those child and also all those education. So it got affected. So as we looked at the role of government agencies in public sector, we have to be very have a deep thinking about how the public sector impact is important, and a foundational role in taking care of those policy agenda, including poverty and food insecurity. We are discussing it, and also not only just one country issue; it becomes a global issue in these days. That's what also Overman mentioned, that the intertwined issues and overall in policy agenda. Thank you.
Awesome. Thank you, Professor Bach. We'll give Dr. Muhammad a chance to respond also if he cares to. Dr. Muhammad, would you like to respond?
Yeah, I think for the part of the USAID, yes, for the shutdown of the USAID, yes, I can comment on that definitely, because and in particular in relation to food security, because the largest USAID project in Egypt was in the agriculture sector. I don't recall the exact name. It's Egypt Rural Agriculture Strengthening Project or something like this. I think it was around 200 million US dollars for 5 years. And this is in Egypt terms. This is a huge amount. And the project used to support smallholder farmers primarily through linking them to market. The main challenge that this type of farmers face in Egypt is that they are often exploited in the market. They don't have access to market. They have a huge amount of food loss during the harvest and post-harvest process because they don't have the facility to store their crops and so on. So this project was one of the most successful projects, reaching out to thousands of Egyptian farmers every year, connecting them to markets and so on. But of course, with the termination of the USAID, this was ended. But aside from that, also USAID, they had several projects in Egypt working in democracy and governance, working on education, working on fighting corruption. So many projects that were implemented in Egypt, and I believe they have had, very positive impact on these areas. But with its termination, I think it lost a lot. The other thing is that the USAID was one of the biggest funders to WFP, the World Food Program, and the UNICEF, both of which have been severely affected, of course, by the end of funding that they used to receive from the agency. We don't have any kind of rigorous research yet on that issue and the implications of it, but yeah, it's obvious.
Thank you so much, Dr. Mohammed, for your great insights as well as you, Dr. Bach. At this point, we are going to conclude our proceedings for today. I would thank everyone who attended on behalf of the NASPA organization and certainly Pi Alpha Alpha Global Association as well. This has been such a great pleasure. Again, to each of our panelists, Dr. Bach, Ms. Karen, Dr. Mohammed, thank you all for your great insights. To my colleagues on the Pi Alpha Alpha Steering Committee, I thank each of you for being with us today and for giving of yourselves. And of course, we can't conclude the proceedings without thanking Alex, who has been with us a number of years, and he makes our Pi Alpha Alpha events look easy, and they're not. And the technical piece of it is not easy, but he does it without complaint, and we thank him for it. So, folks, I will just also conclude by saying that this is our period of time where we accept uh, nominations for honorary membership. Pi Alpha Alpha membership honorary is the highest uh, distinction that we give in our organizations. And once someone is an honorary member, they become a regular member of Pi Alpha Alpha. If you're interested, please contact Dr. Overman. She's chairing that committee along with Dr. Ada Sisi, who's also co-chairing together. Um, the nominations are due by June 1st. And I will say in past years, Dr. Kim has been our amazing chair, but had to step down this year because he's co-chairing our NASPA conference, which is huge. We're all excited about that. That will be in Seattle. So we're looking forward to that. So again, if you have anyone you would like to nominate for honorary Pi Alpha Alpha member, please contact Dr. Overman by June 1st. And with that in mind, I thank you all very much. Have a great day, good afternoon, good evening.
Thank you, everyone.
Cheers,
Bye,
everyone.
Thank you.
everyone.
Bye bye.
Thank you.